So I welcome you to the Canada session, and we are pleased to see you coming from all around the world right now. So it's more and more persons joining in. That's great. Different, diverse background groups, and all, in fact, motivated by the same will to end this pandemic for good. So that's great. But today, during the session, we'll be sharing and exchanging on the Canadian experience during this pandemic. So I'm sure many things that we've seen in Canada might be translated in your own context, but we'll want to share what we've done and what we've seen and what has been good and bad as well. So we'll start with short presentations from talking about the Canadian context itself, and then we'll have an outstanding panel with Q&A, so you will be able to participate, questions, comments, and whatever. That will be in the second portion, which will be the longest, essentially. But first, I wanted to make sure that this session has been prepared by a group of groups. So it's an example of collaboration. So Zero COVID Canada and a coalition of aerosol transmission, which is itself a group of 5 groups. So it's a coalition, and including Zero COVID Canada, which has prepared that. So that's one of the examples we want to show. And I will let the two representing persons for this group just take a minute or two to explain what they are. So I will ask Jennifer Tomaszewski. I don't see you right now. So are you in the... So as I've explained, the line in the middle, and I will show it a bit better, is essentially for those who would have the capacity to speak. Right now it's a screenshot sharing, so I can change, and we'll have later on a Q&A portion, which will be like this one, and you will be, all those who would like to ask questions will jump on the question mark position you're seeing right now. So if I'm jumping back into the view audience, so Jennifer, I think you need to jump on the middle row if it's still possible.
It's not possible.
Oh, but I hear you, and everybody must hear you. So that will be fine anyway.
Okay.
Okay, so go ahead, Jennifer, with Zero COVID Canada.
Sure. So I'm Jennifer Tomaszewski. Zero COVID Canada is a nationwide citizen initiative effort by researchers, physicians, engineers, activists, teachers, lawyers, educators, and concerned citizens. We formed through making connections on Twitter, beginning loosely in the summer of 2020. At that time, we were individually concerned about the public health decisions we saw our various levels of government making, and jointly shared the goal of COVID elimination. Pressure particularly mounted as we neared September, and our school reopening plans seemed to consist of hand sanitizer, a lot of hand sanitizer, and masking, although in many classrooms, we weren't even required to wear them. So you had to walk down the hallway with a mask, but take it off and you were clustered in a room without ventilation. So in the fall of 2020, many of us also participated in the formation of the group COVID is Airborne. The airborne issue and Zero COVID are intertwined. So we helped to form this international group and helped to create the global citizen petition to pressure the World Health Organization to correct its transmission guidance. In November 2020, we started a Zero COVID Canada private Twitter direct message group, and we began to have regular meetings via Zoom. We would participate in the Twitter fray every day, notice like-minded people, send them direct messages to introduce ourselves, and ask them if they would like to join our private ZCC direct message or Slack, where members were having conversations and collaborating. So we now have about 70 members with about 20 to 30 people who are really active. In February, we launched our Zero COVID Canada Citizen Open Letter, which we supported with the launch of our Zero COVID Canada logo, webpage, Twitter profile, and Facebook page. This letter to our federal and provincial governments asks for the elimination of the virus, airborne mitigation, travel quarantine, and protection of vulnerable people. We received almost 7,000 signatories, and after we released our letter, the idea of elimination was first discussed in an emergency debate in our federal parliament in April 2021, right around the same time. So through the fall and winter, we built relationships with journalists. We've also formed relationships with other like-minded groups across Canada. So that's basically Zero COVID Canada. So thank you. And I think Marianne is next. Is that right?
Yes, Marianne Levinsky from the Coalition on Aerosol Transmission. Marianne, are you able to go down to be able to speak? And I don't see you in the bottom. Okay.
Maybe people who aren't speaking could move out of the
Yes,
rows
maybe.
right now.
Trying, but it won't let me move row.
Oh, it's
Okay,
okay.
Marianne, are you
You're-
able to get on at the bottom of the?
I can't find my icon.
Your icon is on the just the second row from the top. I see you right now. So if you find it there, it's really up above, but the second row can just take it and go down. If you click on it and you move it down, I think
that did it. Can you hear me now?
that's perfect. Thanks
Okay,
very much.
good.
You can go ahead.
Good.
Go ahead,
Thank you. Okay. Glad to be here. I'm glad I made it into the out of the bleachers. Well, thanks. So I am Marianne Levitsky, and I'm very happy to introduce the Canadian Coalition on Aerosol Transmission. We also came together in December 2020 from a variety of disciplines who had learned that we'd all been sharing similar concerns. We come from disciplines including medicine, law, engineering, virology, respiratory protection, and occupational hygiene. And most of us had been concerned about aerosol transmission since the start of the pandemic, especially learning from Canada's experience with the 2003 SARS epidemic. And we were very concerned that those lessons were not being learned at the time. Some of our members had started writing a letter, and we kind of came around together to help foster that letter and get signatures, and we ended up publishing that with about 600 signatures. It got a lot of good media attention, and ever since then we have been meeting regularly, almost weekly most of the time. We've come at it from somewhat different but shared perspectives, but somewhat different lenses. Some of us are occupational hygienists. We were very concerned that there was not enough attention on workplace transmission and how to prevent it. Some of us were medical professionals who came at it from the point of view of inadequate protection for healthcare workers, and two of those doctors were also concerned about, as parents, with transmission in their children's schools and with an inadequate prevention, especially ventilation. So after that initial letter, we've carried on. We've written subsequent letters. We've gotten some fairly good media attention. We have made recommendations to government agencies, and we have been quite pleased to see that there has been some changes in Canada in terms of acknowledgement of aerosol transmission and some changes in advice given. So as was mentioned earlier, we are made up of a number of different groups, and some of our members are here today, but I won't spend time on that because others will be speaking to it. And I think we have some documents available that will list our members and the groups involved. We also made an introductory video, so I'm not sure where you can see that, but I would encourage you to see that because it will give you a lot more detail. So thank you again for this opportunity. This is very exciting, and I'm really looking forward to the whole summit. Thanks.
Thanks very much, Marianne. So great presentation. So we will now have Alec. Yes, thanks. Great. Thank you, Marianne. Alec Farquhar. So you're also up above. So you might need to jump down a bit like Marianne just did greatly. And Alec will talk about the background on the measures and the recommendation following the Archie Campbell Commission that was talking about SARS-CoV-1 and kind of been forgotten partially, if not in big portion. And Alec, I'll let you, you're speaking so much better than me about this, so I'll let you go ahead. Probably you're still muted.
There you go. Can you hear me now?
Yes, that's absolutely great.
Thanks very much, Stefan. Hello, everyone. I'm so pleased to be here. I guess I'm leading off with why Canada wasn't ready for COVID. And we could have been. Why weren't we? Canada, and especially Toronto, Ontario, was the main place outside Asia hard hit by SARS in 2003. That was 18 years ago. That was 17 years before COVID-19. SARS exposed many vulnerabilities. It galvanized a major review of our preparedness for pandemics in Canada. The central review was done in Ontario by Justice Archie Campbell. I played an important role in implementing his report as director of the Ontario Ministry of Labour Occupational Health and Safety Branch from 2005 to 2008. So I lived this for 3 years. I thought we'd made lasting changes that would protect Canadians and Ontarians from a future pandemic. We put important institutional and pandemic preparedness measures in place. First of all, legally, we made occupational health and safety a priority over public health directives right in our public health legislation. But in practice, since then, Canadian occupational health and safety regulators have usually deferred to public health, often to a lower standard of protection for workers. Here are the main elements in what we did, mostly in Ontario, but also in Canada, and what happened to them. We established stockpiles of PPE, especially N95 respirators, millions of them. The stockpile of 55 million N95s in Ontario was allowed to expire without replacement. Just think about that. Ironically, we were landfilling the last of the stockpiled respirators in December of 2019, 2 months before, in fact, when COVID was getting started. We implemented the precautionary principle by making airborne precautions the mandated response to novel respiratory viruses. Well, this was abandoned in Ontario and, for that matter, the rest of Canada in March of 2020. Why? Partly because we didn't have enough respirators. They were in landfill by then. This created a chaotic, polarizing, dreadful situation in our workplaces, especially in healthcare, where ultimately 100,000 Canadian healthcare workers were infected. It's a big, big number. Lots of it was preventable. And of course, many residents, especially in long-term care, got sick and died. We and myself in person implemented proactive inspections of long-term care homes in Ontario with a focus on infectious disease control. Well, these were abandoned in 2018. They lasted more than a decade, due largely to lobbying by our for-profit long-term care homes. So profit triumphed over public health and worker health. And it meant long-term care homes really felt they had a get-out-of-jail-free card and were very vulnerable, both for the residents and workers. We also implemented a Canadian monitoring and early warning system for potential pandemics, and it was a world-leading institution. This was gradually weakened to the point of ineffectiveness by bureaucratic decisions and is now finally being revived. And finally, we came to rely far too much on offshore manufacturing of PPE and vaccines and had to pivot rapidly to develop made in Canada PPE and to acquire vaccines from countries which maybe needed to keep them for their own people. So look at all this, all these measures, all the thinking, all the planning, so much of it abandoned, so much of it neutralized, and that left us vulnerable. This was no accident. This was preventable, and we cannot ever allow this to happen again. Thank you.
Great presentation. Thanks, Alec, for this. And effectively, we were theoretically prepared, but in practice, it wasn't the case. Thanks very much. So now we have, as a follow-up to this, yes, great. I will add mine, by the way. It's worded. So we'll have presentation from Brenda Snyder. She's from CEIU, and she will be talking about, from the healthcare point of view, of the LTC, the long-term care tragedy we had in Canada, and that Alec just highlighted quickly. She's seen it from really close. So go ahead, Brenda.
Thank you, and thank you, Alec, for your presentation. It tells us a lot of what happened in Canada. Specifically in Ontario, we had issues from the very beginning when this happened. Frantic phone calls from the members that we represent over their PPE being locked up and not being available to them. No communication as to what they should be doing in regards to this. And we immediately sought communication with the employers, having to, at times, being able to, or having to, going to a legal remedy to be able to find out the amount of PPE that was available, what precautions that they were going to put in place for our members. We lost, tragically, some healthcare workers within our long-term facilities, and many senior people that put their lives in the care of these facilities. And I'm not going to fault the healthcare members. It was well known far prior to this that our healthcare facilities were short of staffing to properly care for these. We had to call out to the government to bring in the military to help in many of the workplaces. And tragically, they also found out and gave a report that told the story that we were trying to tell everybody, that the short staffing was an issue within many of these workplaces. We are trying to work with many of these employers and keeping them accountable in health and safety for our not only the members but the people that they care for, because if a worker isn't safe, neither is the person that is in that facility. And we hope that it doesn't happen. We are determined and we are pushing forward in making everyone accountable that this doesn't happen again, that we work together, not separately, that we don't just forget what happened in the past. And as Alex said, we thought the measures were put in place. It seemed thrown aside, and we don't understand why, and that we, keep together in working so that this doesn't happen again. Thank you.
Thank you very much, Brenda, to give us the workers' point of view on that tragedy we had. So there are echo, I don't know why. So that's better now. So we will now have another, thanks very much, Brenda, still lefty. Bravo. So we will now have Simon Smith from the Canadian Standard Association, that will give us another point of view from another lens, so the regulation, especially on the PPE side. So I don't know, Simon, I see you. So I think you can just go at the bottom as where Brenda and myself are, and yes, you can go ahead. Hi, Sam.
Thank you very much for the opportunity to speak, and it's very grateful for having invited me. This really concerns, again, along the lines we've heard of some of the best laid plans that didn't work out. Following the SARS epidemic and the learnings from that, the Canadian Standards Association, which provides a standard for selection, use and care of respirators that is generally applied in workplaces across Canada, it worked in period from 2007 to 2011 in creating world first guidance for selecting respirators for biological aerosols. And this was done entirely with the pandemic in mind by an expert committee and finally published. And it used a control banding method, which was a new approach, so that the various factors involved in the workplace environment, the generation rate, the ventilation, and the type of pathogen were considered in advising on the necessary respiratory protection. And we were talking adequate protection with fitted respirators, not considering surgical masks as adequate. This was published 10 years before the pandemic started. And unfortunately, despite this forward planning by an expert committee and the acceptance of this standard across jurisdictions in Canada, when it came to authorities that actually provided guidance, the medical authorities and governmental agencies, you could not find a reference to the standard anywhere. And I know in some of the contacts we've had since then, they were even surprised, some of the people we talked to, that it actually existed. So it was very unfortunate that a lot of expertise had come together, a lot of work had been done, and that we had, in the end, something that was almost entirely obscure by the time the pandemic arrived. The good news is that we are making people aware of that through the Aerosols Coalition, and we are now seeing much more interest in the standard. We also see interest from overseas, and if anybody would like some more details, certainly please contact me. But the lesson really is that don't expect that collaborative planning by experts, and sometimes even legal mandates around this standard, can overcome the traditional mindset around infection control and the fact that for an unfitted product on your face is actually going to provide adequate care and protection for the wearer. Thank you.
Thanks very much, Simon, too. I like that. So effectively, the mindset kind of blocked a portion of the preparation that was made before. Great, great insights. Thank you very much. So we'll now have Dorothy Wigmore. Yes, always forget. My learning curve is not still at the end of the end. Thanks very much, Simon. So,
thank you.
And so Dorothy Wigmore will talk about the myths and the reality regarding disinfectant and hand sanitizer and all these stuff we're hearing so much, but are not. So maybe Dorothy, you can jump down. Yes.
There.
Hello.
Yes. Now I made myself some slides. Can I just share my screen in the usual way?
Oh yeah, I just need to switch for this mode, and I think you now can share if you use the icon at the top right.
Okay. Okay.
I'll see if I made my homework correctly, and if it's working, fine, all good.
Now I should warn you. Oh, okay. Is it there?
Yeah, I don't know if we can have this up front. Yes, that's better. Thanks.
Okay. Is it there?
We see it.
Because I can't see. Okay, great. So I just want to talk quickly about disinfecting in the pandemic and how it's more than hygiene theater. It's actually a health hazard, especially for women. Sorry. So just very quickly, I want to remind folks that cleaners get rid of germs and dirt, that sanitizers deal with bacteria and are less effective than disinfectants, which can destroy almost all infectious germs on a surface, but needs to be done with special methods. Interestingly, they're regulated in Canada as drugs. Unfortunately, whether it's the media or business or even government, they're a little confused about what sanitizing is these days, and they keep on using it instead of disinfecting. People have, sorry, this is escaping from me. Hygiene theater is a term that we first heard back in July, about a year ago, in an article in The Atlantic. Other people were talking about it earlier. For example, Emmanuel Goldman was saying that there wasn't even a measurable risk for the virus on surfaces on a CBC program. And then there was other media. There's some in August, and more recently, there's been some talk of why are we wiping down groceries and things like that. What was really important and hugely delayed was the US CDC saying on April 5th that cleaning products with soap and detergent would do the job. And they've reiterated this on June 15th, pointing out, that cleaning once a day is usually enough. But the message we've got from the Canadian government, and it's still there, is essentially clean and disinfect, especially in workplaces. And so one example of a workplace is the Windsor-Essex School Board, where they've insisted that these products are approved by Health Canada, so they must be okay, despite parents raising concerns, as teachers raising concerns as well. And so the idea seems to be, as long as it's used correctly, that's just fine. However, what it's ignoring is that many disinfectants contain toxic ingredients. Quaternary ammonium compounds are some of the most common ones, like these Lysol products, like bleach, they're asthmagens, and they have a whole lot of other health effects, and still Health Canada and EPA approves them. So the essential question is, are these things necessary? And basically, no. There's not very often. There are options, so-called environmentally preferable products. There are a variety of certifications. There are checklists out there and other kinds of documents that can lead people to less toxic options if you actually have to. And then there's really soap and water. Work done at the Toxic Use Reduction Institute in the States shows that if you wash hands and clean, that you basically get a 99.99% reduction in the virus, and which is 0.0099% less than what you get with the disinfectant. And the other thing I've been recommending a lot are microfiber materials, which can deal with viruses, bacteria, and others. And it lost my last slide, so I'm going to tell you what it said, which was that we have to stop wasting money, require cleaning the air, not surfaces, and recognize that it's more than hygiene theater, that it's hazards that affect our health, and antimicrobial resistance is at stake.
Thank you, Dorothy. That's effectively, this hygiene theater became sometimes a circus at some points, and it was absolutely relevant to highlight that we faced it in Canada, definitely, as in many countries, I know. So the next, I'm not sure, I've not heard from Connor Rudzicki. Are you in the? Okay, so what I'll do, the following speaker is...
I'm here.
You're here. Okay, so Connor, you can jump down. Oh, you can just right like this. Okay, great.
Sure.
Perfect.
Thanks, Stefan.
Thanks.
Yeah, so I was asked to say a few words on a particularly challenging aspect of our pandemic response in Canada. And that has been the general hesitancy to acknowledge the roles that aerosols play in the transmission of SARS-CoV-2. So everybody here is, I'm sure, familiar with the airborne nature of COVID-19 and the challenges that are associated with trying to control a disease that is spread via inhalation. You know, they've become very clear in the past 18 months or so. And as other speakers have already discussed, we really should have taken a precautionary approach with respect to airborne transmission from the get-go. But aside from the failure to invoke that principle, I think what we're observing now is an issue where we continue to see a severe downplaying of the role of aerosols in transmission in general. So the evidence base that has developed specific to COVID-19 in the past year has created a very, very strong case for aerosols. And in fact, we've learned that our previous ways of thinking about respiratory disease transmission, they contained a few critical errors. Probably the most obvious one is conflating that proximity of transmission means that you have ballistic drops. So I think the past several months have seen this information sort of start to break through into a more mainstream understanding, at least among professionals in fields that were not previously familiar with aerosol science. But we have an entrenched public health apparatus in Canada that have essentially avoided using terminology like airborne inhalation or aerosols. And many of the people that are involved in this apparatus either do not believe that aerosols are important or they're unwilling to admit their errors. So I think this speaks to a bit of a disconnect between, what is actionable information in a time of uncertainties in different fields and different professions. And that's continuing to be a very tricky problem to tackle. So various groups across Canada have taken numerous steps to bring attention to this issue, as was discussed before, the letter that was, sent to the federal and provincial governments on aerosol transmission signed by hundreds of professionals from across Canada. But there's been a general lack, more or less a general lack of acknowledgement of this information by people who are actually in positions of influence in terms of policymaking. So, and I think the lack of acknowledgement of airborne transmission has led to very bizarre prioritizations of what businesses were allowed to reopen after each wave, and sort of misleading and inequitable characterizations of risk in various different environments. We've had major outbreaks in workplaces like factories, meat processing facilities, and work camps owing to an almost total lack of consideration of inhalation risks. For healthcare workers, obviously, we've seen the blaming of individual healthcare workers for outbreaks occurring in hospital environments, when these same healthcare workers have been denied adequate respiratory PPE. And we've had considerable transmission in schools. But potential health risks in children have been downplayed by certain health professionals, and with many provinces either removing public health restrictions now entirely or moving towards that direction. Well before we're having vaccination in the youngest age groups, we could be heading toward a situation where we have a significant problem in schools come September when these schools are back in session. So, just to end off, I think given where we are now, I'm a little bit pessimistic that we can change gears in some of the provinces quickly enough to really mitigate the potential worst effects of a fourth wave, particularly in children. But I really hope that we can use the experience that we've had here to change the interaction between public health and other relevant areas of expertise. I think, another thing here is that there are questions for groups like the different professional associations, different professional engineering associations, particularly, across the country, as to whether their members have professional obligations to act, given, at least with engineering, the position statement from ASHRAE that mentions, airborne transmission is important and it is a target for control. But I feel that these are things that are going to require perhaps the involvement of law or court cases to actually see movement on, unfortunately, and that takes time. So if we do miss the opportunity in Canada to change things now, we absolutely need to take the lessons that we've learned and apply them in the future to avoid ending up in the same place in the future. Thanks.
Thank you very much. And you're absolutely right. There are still a lot of work to do, and we might be pessimistic, but we need to work to make sure it converts to optimistic somewhere. Thank you very much. And by the way, I forgot to say that you're involved since the beginning almost with COVID is Airborne and with Mask for Canada in Canada as well. So thank you, Connor. We now have John Udyk, which is an occupational health and safety specialist, and we will be talking about workplaces and the risk associated with that. Go ahead, John. Yes, I'm clicking on it. It should be coming in. I might need some support from Angela to push it
I'd like to
forward.
describe some of the infection control practice advice that we've been giving workplaces.
Okay, that's perfect.
We created a website that provides escalating advice based on your region's COVID-19 infection.
John, we don't hear the audio.
Mm-hmm.
We divide regional.
Maybe it's the headphones. That was the case in another one that they had to unplug. Okay.
Yes, you can give us some insights.
We created a website that provides escalating advice based on your region's COVID-19 infection experience. We divide regional risk into 5 categories: minimal, controlled, some community risk, wider community risk, and high risk. And then we rank the public health units, areas, by these risk levels. And based on the rating for your region, you can figure out what type of controls are necessary for that level of risk. The advice is broken down into 7 categories: communicating, cleaning, hand washing, ventilating, distancing, screening, and masking. Here's the advice related to ventilating, and remember the colors are related to the risk in the community. Here we have a checklist that we put together for workplaces to work through to deal with some of the issues on ventilation. We've also provided some ventilation assessment criteria, and as you can see here, the average seems to be to use 800 parts per million as a surrogate for 4 to 5 air changes per hour. We also recommend that people buy CO2 monitors and use this interpretation criteria in order to keep occupants aware of the quality of the air and what they can do about improving it. For masking, when the community level is at minimal risk, masking is really symbolic. It's a token of solidarity. We're all in this together. However, once the control rises, you need to practice to be ready for when things actually get risky. And when there's some community risk, it's good etiquette, good manners to keep your emissions to yourself. And when things are at a high risk level, it's protection for yourself along with the etiquette of keeping your emissions to yourself. A few months ago, a piece on our national broadcasters showed that the fit factor for surgical masks is only 2, whereas fit factor for N95s is anywhere between 10 to 100.
Mm-hmm.
Yet in Ontario, there are healthcare facilities that refuse to allow people to wear N95s, and they have to take them off and put on a medical mask. And so the struggle goes on. Thank you for your attention.
Yeah, we still need to educate authorities, and you were right showing that the workplace is it's really important, and to have tools like that's really great. Thanks very much, John, for this presentation. That will end up the short presentation portion. We'll jump in the Q&A and the panel itself. We have a really great list of panelists. And I will let them present themselves one after the other, and then you'll be able to ask questions. You have I will just come back to the audience, but I will put, sorry, the Q&A portion. So you have the white box on that's for the questions essentially that you can ask, or you can come down for the people and ask question in the box below. But first, we'll start with our panelists, and I will be helped by Valerie. Valerie, maybe you can come down as well, by the way, just beside, and we'll have panelists coming after the other, or we have 6 panelists, so I'm trying to do it the most efficient way. Right now, we can have, we'll have Gojia Gasperovic, and maybe Lisa Yanatone, you can come down as well. We'll go by 2, and then I will jump up and let more room underneath. So Gojia Gasperovic, which is a developmental biologist. So I will let you a couple minutes, 1-2 minutes, just to present to yourself, but also give us some insights you want to recall, just to introduce, and then the discussions will start with you. And we'll have Lisa just after you. Okay, let's go ahead.
So thank you, Stefan. Good afternoon. My name is Gosia Gasperowicz. I'm developmental biologist from the University of Calgary and a member of Zero COVID Canada and Go for Zero. And I would like just to mention answer some of the questions that Stefan suggested about positive examples from Alberta, because we all the time talk about bad things from Alberta. And so the positive things were that we had really good pandemic reaction from the cities. So, for example, the city of Calgary Emergency Management Agency, CMA, was really great. They basically took action very fast. They announced, together with Calgary City Council, they made local state of emergency, and they were first in the province to implement mask mandate. And it's their reaction sort of percolated up to the province. And the other good thing from Zero COVID Canada is our collaboration with Alberta Union of Provincial Employees, who adopted Zero COVID principles in their operation. And for me, it's a sort of a sign that people who deal with fires or emergency on everyday basis, they just know how to react and how to deal with the pandemic. So whenever I talked with Calgary emergency management people, it was no-brainer for them that, okay, we need to act fast and we need to finish the job. So it's almost like, I don't know, recently I've been in the wilderness and you have this information from Alberta government, how to put down campfire. So soak it, stir it, and soak it again, to make sure that no spark goes out. So if we would have such attitude to pandemic, there would be no pandemic now. And talking with many people over last year, the idea was coming up now and then about making something like pandemic response agency in Canada. So a separate body from just responsible for dealing with pandemic that would be independent, so the government cannot just fire people, multidisciplinary, so there would be emergency response specialists there, engineers, lawyers, educators, scientists, representatives of different groups in the communities, physicians, public health, and parents and others, empowered to take action, and transparent. So there would be no things like no disclosure contracts there and such things like we have in public health, basically, which stops action from being effective in some way. Thank you.
Thanks, Gosia. Great insights. Just before Lisa, I forgot to mention, Valerie is the executive director, which will be helping me for the moderation of the Southern Ontario OCOW Clinic. OCOW is the Occupational Hygienist of Ontario, the association. So this is done. I forgot this. Sorry, Valerie. Lisa, that's your turn. So Lisa is an MD, medical doctor, and she's also involved in many groups, COVID Stop in Quebec, Mask for Canada, and so forth. So go ahead, Lisa.
And so I'm an MD. I work in Montreal, which was hit very hard in the first and second waves, and was still hit pretty hard in the third wave, just shown by cities at the Mars. I'm not a frontline worker, but I do work in underprivileged neighborhoods, very racialized neighborhoods with basically very vulnerable populations. And those are the neighborhoods that were the hardest hit by COVID. So, you know, it's no secret that our response left a lot to be desired. It wasn't very good, but I think it's important also to mention who suffers the most from the terrible response, and it isn't the people making decisions. It's really the people in these vulnerable neighborhoods, these racialized communities, those socioeconomic status, essential workers. So I just want to share some statistics. So unfortunately, our statistics are only from the first wave in Canada. That's Statistics Canada. So in the first wave, neighborhoods of visible minorities had double the mortality rate than the neighborhoods that are mostly white. And if you go by province, the difference is even worse. So in Quebec, racialized neighborhoods had triple the mortality rate. In BC, it was 10 times the mortality rate of white neighborhoods. And then if you look in Montreal, it wasn't only that they had more mortality and infections, but they did worse on all parameters. There was more loss of income, more job loss, more difficulty paying the rent. And if you look at the map of Montreal, the hardest hit neighborhoods, the most COVID, it's also the areas of Montreal where the most essential workers and the most healthcare workers specifically live. So I think it all comes together, not giving healthcare workers the proper PPE. We know they have 10 times the infection rate in Quebec compared to the general population. They bring it home to their families, to their communities, and the entire community suffered. And for me, it's really just a heartbreaking situation that I think didn't get enough attention.
Thanks very much, Lisa, to highlight the fact that the vulnerables have been hit harder than most of the population. Great point. So I'll ask Fatima Tokmash and Tracy Edwards to come down. I look like if I'm at the prices right. Sorry, it's my age which is popping up. So for those who are not the same generation, maybe you don't know, but it looks like. So Tracy and Fatima, please, thank you. And Gosia and Lisa, don't go very far. Stay in the middle line because you will be able to answer the questions later on. So as much as possible, stay in the second or third worst case, but second line. So Fatima, Gosia, same thing. Are you able, or it's blocked? Okay, so we'll start.
I can't unmute myself, sorry.
Okay, so anyway, we'll start with Fatima as soon as, and I will try to go up as well. But Fatima is a geneticist and also a bioethicist as well from McGill University Medical Center. So I will let you go ahead with your presentation and your two minutes.
Thank you so much. I'm very grateful for this opportunity. It's lovely meeting you. I've met some of you on Twitter, I'm sure. But for the rest of you, it's thank you very much for this opportunity. So I am a geneticist. I have bioethics training. I do vaccine research, mRNA technology, vaccine for cancers, not for this virus in particular. I am a member of a number of different committees, pandemic response committees. Most recently, I am a member of a federal level task force that is funded by the CIHR to address the variants of concern. So I can answer some questions related to that as we go along. But what I wanted to touch on really briefly is, again, it pertains to science and science advice and science policy, and the fact that throughout the pandemic, as somebody who was sitting on multiple committees trying to offer advice to various levels of government, I was very shocked and appalled at the fact that the level of science literacy in general is extremely low in various levels of government. We had a hard time conveying the most basic of concepts. So you're all here, ventilation and air, those are not my areas of expertise. So I am also a novice to those topics, but so you have to appreciate that bringing those topics and wanting to convince the policymakers and people in power to appreciate them, it's beyond them. We had challenges and difficulty conveying the very, very basic elementary biological concepts to them and trying to get them to appreciate those facts and make policy based on that. When the 2003 SARS epidemic happened, I wasn't even a teenager, but I had the good fortune of being trained by people who actually managed and mitigated that response, and that sort of helped me understand where we were and where we have ended up, and the fact that through decades and decades of various scientific institutions being gutted, including the National Research Council, which is why we didn't have vaccine making capacity domestically. And the fact that we don't have, all the way up to just a couple of months ago, we don't have a permanent science advisory institution within our democratic system, within our parliamentary system, whether be it at a provincial level or federal level. It's just recently that finally we got, for the next parliament, we're going to have a standing committee on science. So these are all the things, all the challenges that sort of made and exacerbated the whole problem further. The issue of politicians being the communicators as opposed to us, the scientists. We were the people who were on the field, doing the work, collecting the data, seeing how it unfolds, advising them, and then a lot of us had to sign non-disclosure agreements, and we weren't allowed to communicate anything. It was them who would come and do the press conferences, unlike many other countries that had very good response, like South Korea, New Zealand. In those countries, you would see the chief science advisor, you would see the science table come and communicate, be the point of communication with the public. So we were in the face of the communication of the various issues. And I think that caused a lot of misconnect, a lot of miscommunication. A lot of politicians became the perpetrators of misinformation, be it about airborne transmission, be it about variants, about vaccines. So those are the issues that I, myself and the group of scientists that I work with are very, very concerned with. I also want to bring your attention to a work that my group did, and that's, we work with the Royal Society of Canada, and we collated basically all cause mortality, excess mortality that has happened during the pandemic. I put the link in the chat if you want to take a look at that, but it was a very heart-wrenching and heartbreaking report to put together. I encourage you all to read it. We got in a little bit of a hot water with StatCan because of that report, but the data has been peer-reviewed by a number of high-ranking epidemiologists and people in public health, and those are the lives lost. Those are the lives that could have been saved and are lost. And with that, I'll stop and wait for questions.
Thanks very much, Fatima. You're right, listening to science, but also transparency were issues, and they are still issues in Canada, but I'm sure it's talking to many others in other countries as well. Tracy, so that will be your turn. Tracy Edwards, so you're from Health and Safety. You're the Health and Safety coordinators for the union, so the Elementary School Teachers Federation of Ontario. So you will give us perspective. That is a new perspective for tonight. So go ahead, Tracy.
Yes, thank you. And in Canada, there are many education unions in Ontario and across the country, and we try to coordinate a bit. In Canada, generally, education is the responsibility of each province, which sets the policies and provides funding. Local or regional school boards have different powers in various provinces. Each level of government seeks advice from public health authorities. Last year, the government in Ontario did very little to address physical distancing, cohorting, ventilation, and PPE for staff. A few local public health units were willing to implement stronger precautions than the provincial lines in Ontario. When the Ministry of Labour investigated any of the local concerns, joint health
Oh, are you still there, Stefan? Just a minute, Tracy.
have filed a legal
But Tracy, the sound is off. Maybe try turning off your video.
During COVID-19, unions did win some improvements to protocols in Ontario, such as screening and outbreak management, by continually pointing out the flaws on behalf of our members. A few success stories were achieved through lobbying the local politically elected school board trustees. Initially, masks were only required in grades 4 and up, and after many school boards began requiring masks in the lower grades, the province changed their guidelines. In one school board, as Dorothy mentioned, parents and unions joined together to convince trustees to limit the use of the more toxic disinfectants. Because of the government's reluctance to implement adequate precautions and close schools when necessary to control the spread of the virus, eventually Ontario schools were closed more than any other jurisdiction in Canada and possibly North America. Many of the recent government media announcements in Ontario are emphasizing the return to normal, but the unions are advocating for precautions to remain in place and to be phased out slowly, particularly in light of the new variants and since children in Canada under the age of 12 are not yet eligible for vaccinations. Educators agree that in-person instruction is preferable, but only if adequate safety precautions are in place. And there was a webinar that I did for OCOW a while back with more information about what happened in Ontario over the year, and I will put a link to that in the chat.
Thank you very much, Tracy. Really, really interesting to have the perspective of schools, which is an important portion of our societies. Joe, Vipon, maybe you can come down as well while I will, we'll have Kevin Edges starting, but you can just, while we're doing that, just come down, that will be easier. So Kevin Edges, which is from the Coalition of Aerosol Transmission, but also from Workplace Health Without Borders as well, and many other groups like OCOW. So I will let you complete your introduction and maybe give your insights as the others, and then that will be you, Joe. Oops, I think you're on mute. Still muted.
Okay, sorry about that. And thanks very much, Stefan. And just I'll just quickly run you through these slides. I'm cognizant of time here, so I'll kind of rush through them. I'm the former president of Workplace Health Without Borders, and it's just quickly talking about how we interacted and we became part of the Coalition on Aerosol Transmission. So we're incorporated in Canada. We've got about 2,000 on our network. We've got 800 signed members. We're really about workers, their families and communities. So we're occupational health scientists and we're a global organization, but we were founded in Canada. We've been very busy during the pandemic. I actually wrote a letter on behalf of Workplace Health Without Borders to Patty Hajdu and Teresa Tam about the importance of the airborne precautions, following good science and the precautionary principle approach. We've run 12 webinars in 2020, right from, like I said, in April, we wanted them to acknowledge airborne transmission. We've actually run those webinars involving international folks as well. We also were part of the coalition that wrote the letter to the federal government and the provincial governments, and that's just the logos of the different organizations involved. That letter was sent in January 4th, and then in March the 24th, we actually got a positive response from Public Health Agency of Canada. So advocacy does work. But there has been a study being run through McMaster, which is still going, and it's a questionable study. So we're still talking about trying to get the study stopped. So that's me. Thank you very much.
Thank you, Kevin. Important works that have been done. Thank you to share that with us. So the last and not the least of our panelists. Oh, Joe, you just disappeared on my screen. Hopefully you're not far. Joe, you're back. I think so. You're coming back. So Joe is an emergency doctor, and he's also one of the co-founder of Masks for Canada. And while he's trying to, he's also one of the founder of the Canadian and the president, I think, still of the Canadian Association of Physicians for the Environment. So you touch many great things, important things, and I just want you to continue or complete this intro and give your insights as well. Thank you, Joe.
Yeah, I'm going to try and keep this really quick because, to be honest with you, my favorite part of these sessions are the questions. And everybody's done such an amazing job kind of outlining the problems. And I guess I just want to touch on the why. So we know that airborne transmission has been minimized. We know that the improper safety protocol has been put in place with the hygiene theater and the emphasis on initially with no masks, and then the emphasis on surgical masks and cloth masks over well-fitting masks like N95s, KN95s, et cetera, et cetera. So I guess that's what I would really like to look into. So I kind of at the very beginning was quite naive, and I was like, why are we using masks? Like, this is a respiratory pandemic. We know that China's actually managed this pandemic quite well with the use of universal masking, and yet it was being downplayed by our public health officials. So I started, sending emails to people in my department, and got quickly shot down and even disciplined for trying to question public health. Little did I know that the person I was emailing was one Dr. John Conley, who, as a lot of people here know, is a very powerful person, and here I am, this local. Cause trouble. So, we published some op-eds trying to push for masks, and we suddenly gained a lot of other people that were interested in this topic, doctors, engineers, and we formed this group called Masks for Canada. From our group Masks for Canada was public health or infectious disease. There are some exceptions to that. I want to make special note of Doctors Fisman, Leung, Asadi, and Ladha, who are the exceptions to the rule that public health wasn't engaging. But certainly we were mostly dermatologists, lawyers, non-public health. So I guess the real question is what went wrong? Certainly there were some key personalities that had power at the local, national, and international levels that were influencing things. But there were a lot of people surrounding those, a lot of institutions that seemed to support the ongoing myths. And certainly the evidence as it came out over the last year has been difficult to refute that airborne transmission isn't a key, if not the key, to this pandemic, along with asymptomatic transmission. So I would like to point out that one of the difficulties has been the inability for public health to collaborate with occupational health scientists and aerosol engineers. So there has been this kind of talking to each other, self-affirming group of scientists that have been engaging on this. And so we need to somehow fix this. I don't know exactly what the process is. I'm still shocked that we continue to see, as of yesterday, Alberta Health tweeting out that hand washing is the key to mitigating COVID transmission. Obviously, this is an ongoing problem. It has not been fixed. And until the variants disappear, we need better guidance on this pandemic. And of course, there's going to be another pandemic coming, and it likely will be airborne. And so we need to manage this. We need to learn from SARS-2 the way we didn't learn from SARS-1. And I'm predominantly saddened about what this says about our society and our scientific process with how this failure would predict how we're going to react to the upcoming tragedy of the climate crisis. So I'm really looking forward to the Royal Commission that looks into this, but hopefully we can answer some questions today and try and figure out some of the resistance and systemic problems that led to this, the situation that we find ourselves in now.
Thank you very much, Joe. Really relevant. We need to learn for the next pandemic much in a better way and much more than we did between SARS-1 and SARS-2. You're absolutely right. Valerie, I will let you, as a candidate would say, the puck. I'll pass the puck to you for the questions. No. So we have already a list of questions on the chat, on the right, sorry, the question list, but we can also receive person that would like to ask questions directly, as I've said earlier at the beginning. So you just need to go down where you see the question marks just below me, essentially. And so, Valerie, you can go. And the panelists, there's 3 other spots at the bottom level. Don't hesitate to go there. It's all. I'm
unable to step down from the podium here, and
no, you can stay there, Joe. Definitely, and maybe 3 others, and just to make sure it's easier for the people to see, and the others just stay where the same line I am as much as possible, so you'll be able to respond as well. Okay.
So I guess we have gone already to the end of our official time, but I think we do have. There's nothing scheduled until 10:30.
There's one meeting, but we can but we don't have to start it on time, and we can shorten it.
Great. So I was going to suggest if there are people who have questions who are here and present, maybe we should start with those, because I think we should be able to potentially answer some of the written questions later if we run out of time, because I would assume 10:30 is the absolute latest we could run with questions, even with everybody else's time, the speakers and the participants. So does anybody have any questions they want to ask directly to any of the speakers or panelists who we've introduced today? Stacey, did you have a question? Or Christian?
Yes, I do actually. With regards to how the pandemic has been dealt with in Canada, has there been anything specific put in place with regards to equality laws or anything like that for vulnerable adults and children? Because that's sorely lacking over here.
Lisa, is that something you could answer?
So our response, it basically goes by province, but to my knowledge, no. Barrie, Quebec, definitely not. It was even difficult for vulnerable children to get distance learning. It wasn't offered very easily. And children with vulnerable parents with medical conditions that put them at higher risk were not eligible. They had mandatory indoor schooling, even though cases were spreading very quickly through schools. So it was actually quite the opposite. They had no protections.
that's the same as over here.
If I could add to that, so as Lisa said, it's because healthcare is administered provincially, and even within the provinces, when it comes to childcare, we have different jurisdictions. There are certain things that fall under jurisdiction of the city, the municipalities, and other things that fall under the provincial or shared responsibility between provincial and federal government. We've had great measures being put in place in wherever we have Indigenous reserves and Indigenous communities. And that's, I have to say, is mostly in part through the systems they already have in place. The Indigenous communities, they were very proactive, bringing Indigenous knowledge and expertise and basically advocating for themselves. So that's a whole different issue. Some provinces did a lot better in terms of schooling or in general protection of racialized groups and minorities. I would say the Maritimes in general, they did really well because they already had very good systems in place to protect the vulnerable groups. Alberta actually did pretty decently as well. They had some measures and protections in place. The rest of the country, not so much. So it's very varied.
Thank you very much.
Christian, did you have a question? You moved down to.
Yeah, I've written it in the comment section. There was one presentation where the wearing of masks was recommended as a function of the incidence, while in Germany, generally there is a kind of new term that's called basic measures, and wearing masks indoors is also practiced when the incidence is low. And there are actually some cities where there were no recorded cases in the last 7 days, and people are still obligated to wear masks in supermarket, for example. And this is because the German government says, well, we could remove the obligation to wear masks, but we have to tell people to wear masks again in the fall, and that would be difficult, so we just leave it as it is. And there are not enough people that really complain about this. But I think this concept of basic measures could be very important just to keep infections down on a continuous basis. And I wonder if this is a discussion that you have in Canada.
John, do you want to answer that? And then I guess somebody from Mass for Canada might also want to talk. But go ahead, John.
Masks here are sort of held up as like the symbolic thinking that the pandemic is over or we don't have to think about it anymore. So each province sort of has like dropping mask mandates as the ultimate goal, and some are going towards it faster to already dropped all mask mandates. Some are going towards it slower, so we'll talk about it in August or September, but there's really just this real desire to drop mask mandates in the short term, which I don't think will be possible, but it's become symbolic, like so that people can feel like everything is normal again, I think.
And I'll just say, with what we know in terms of variants, this is what I do day in, day out. We know that the higher infectivity, the higher virulence basically is coming. Our latest experiments show that it's because you are exuding more load earlier on, or you start. Usually there is a latency period between the point that you have come across the pathogen up to a point where, you know, it has replicated enough for it to start basically produce particulates. That period, it's because of the mutation, is just able to replicate faster, and therefore you start exuding particles a lot faster. So that the latency period is shortened. So it's like usually we estimate at about like 3 to 4 days. This is like somewhere between 1.5 to 2 days, Evan. So I don't think anybody should be dropping masking.
No. No. Joe, did you want to add something? I felt like you were about to say something. No?
I
Okay.
was.
Mm-hmm.
But the problem is that when you drop masks, what actually happened if you make it optional for the institution can be explained because Canada has largely looked at the United States, with the exception that Canada, outside of Quebec, will Okotodo force them to change, says that you don't need N95s in healthcare for even for COVID patients outside of these so-called aerosol generating procedures. But in the US, what has happened with the CDC guidance is places have dropped mask mandates. States, once you said vaccinated people don't need to wear masks, most states said we're going to eliminate mask mandates if we have them. Businesses say CDC guidance says we should not be requiring anyone to wear a mask, and we're going to trust that they're vaccinated. And that would likely happen in Canada and other places.
That's our fear. Thank you, Theo. Does anybody else have a question? I think Eddie and Nicholas are down here, but Kevin, were you wanting to add something? Did I see
Yeah,
that?
I just wanted to add, we have an excellent Canadian standard on respiratory protection. There's a section in there on bioaerosols. It takes all the guesswork away from where you wear a respirator and where you don't. There's one for healthcare workers and one for non-healthcare workers. In Australia, the Australian standards, they become default regulations, so to speak. In Canada, we need to adopt that Canadian standard. We need to push hard for that Canadian standard. Thanks.
Which is adopted nationally and in Manitoba, the only two places. Well, nationally for federally regulated employers, I think, right? Okay, Edie, did
try
you have
again if I could just try and say a couple of words. I was just going to mention that this has become politicized, and it's crazy that it has. I often think about what this pandemic would be if Trump hadn't appeared on the scene, because I really feel like he was the one that initially brought in this idea that putting a piece of fabric in front of your face was an infringement on freedom. And so we still have this going on, this idea that, the simple act of wearing a mask is akin to, I don't know, it is akin to being told exactly what to do at all times, some kind of authoritarian state. And it drives me crazy. And the reality is these mask mandates, they work. In Calgary, Alberta, the day before the mask mandate was put in place, we had 25% of Calgarians wearing a mask. The day after, it was 90%. It's just we as as a species, we rely on leadership and rely kind of on being told what to do. That's not what our kids, they need us to give guidance so that they're not just free to do whatever they want. And so we as a society need that as well. And I tell you, now that we're back off the mask mandate in Alberta, we're back to 25% mask use. So it's not gone away, but if we want those high levels that are required to bring down the RT, we need mask mandates.
Thanks, Joe. Okay. Edie or Eddie, do you have a question? We can't hear you. We still can't hear you. Although it looks like your microphone's on.
You need to set the microphone in settings.
Yeah, where
the external
tool,
microphone.
where the gear is.
At the top right, you'll see that.
Is there anyone else with a question, Nicholas?
I think Simon had his hand up.
Oh, I'm sorry. I didn't. Did you want to say something?
Well, it was just concerning masks and issues around them, and I apologize. Something I missed off my earlier presentation. I thought we were doing it in two parts, but there is some good news in that in Canada, for the approval of respirators for use in healthcare or other workplaces, we've always relied on the US system, the NIOSH approval that was mandated in legislation across the country. NIOSH worked extremely hard during the pandemic and really pulled the stops out, but they did prioritize non-US countries. And so Canada felt it could not satisfy its needs with new manufacturers coming on stream to provide masks and respirators for use in particularly healthcare and other requirements. So Canada established with, first of all, the federal government stepping up, and I know we knock them a lot, but Health Canada really did a great job in establishing a standard as part of their approval of medical equipment, and brought that forward in August last year so that companies that were coming online with products in order to address the shortages could actually have their products approved and used as soon as possible. That was a really good step. What's happening now is that Canadian Standards Association is taking that on and making a permanent standard in Canada for respirators, so there'll be a parallel approval system.
You lost him.
In the meantime, Valerie, Eddie's sound is back, so she can ask questions if Simon is not back yet.
Thanks. Oh,
sorry, I might have lost the connection there. Sorry.
Okay.
We're going to go with Eddie now, Simon. Okay.
Yep.
Okay. You have to turn off your mic now, or turn on. Yep, there you go.
Turn on, exactly.
There you go.
Yes, now?
Yes, we can hear you.
Okay, great. No, I have a question that refers to fumigates and to disinfection, and I wonder if there is a consensus. Of course, I'm up to date to the CDC and WHO recommendations, but do you all agree that it's unnecessary? Because it takes a lot of time, like somebody was saying, it's a theater. And of course, I know that it's not as dangerous as transmission, airborne transmission, but still, is there a risk, or should one just skip it completely?
Risk of what, sorry?
Disinfecting of surfaces and this kind of thing. I don't mean washing hands, but I mean like the articles that you bring inside your home.
Virtually no chance of transmission.
Yeah. What is it?
Pardon?
There's virtually no shot at transmission of the virus through surfaces. The most that should be done, and that should be done, is hand washing frequently.
So it was 1 in 10,000, I think I read somewhere, but still it was put very important in the beginning. And now they say that it's not as dangerous. It seems that it's not as important, but all these comparisons, of course, it's not as important, but is it still an issue or not? So, but like the consensus is that it's not necessary to do that.
So I'll tell you what. I work in a BSL-4 facility. I put on a Kevlar.
Could I answer that, Val?
Well, wait, Fatima's just answering it, and then you can finish, Dorothy.
Yeah.
Okay.
So
could I answer that?
Fatima started answering. So Dorothy, can you wait and then add to it?
Sorry.
No, go ahead.
So it's really the anything respiratory, the main mode of transmission is going to be through air. However, depending on where you are, what context you're in, you could have surfaces that could be contaminated. But I'll tell you, as somebody who works with pathogens, with infectious pathogens, I have never, ever, from day one, I've never washed anything I brought to my home. The only thing I continuously, religiously do myself,
Stefan, I was trying to answer the question.
Washing our hands, that's the most I do. I've never, I've heard people washing their groceries or I've never done any of that.
Thanks. Okay, Dorothy, you had something you wanted to add.
Okay.
Yeah, Dorothy, we can't hear you very well.
You're on mute, Dorothy.
Yep.
You're still muted. There. It's quite touchy sometimes, eh? No, it doesn't seem to be. Okay.
Do you want to add to that?
Dorothy wanted to add, but
you're off
are you
now,
able
Dorothy?
to speak, Dorothy? Yeah.
It's off. Your microphone's on, so we should be able to hear you if you talk. It doesn't seem to be working, or she can't hear.
Okay.
Okay. So there's some other people. Nicholas, I see you've moved down, and Noor, I see, has moved down. So do you have questions?
Yeah. So
Sorry, go ahead.
if John Kodak has the story straight,
Dorothy, try turning off your video because your sound is intermittent.
I not on my machine.
It is here.
Just disabled your camera.
Okay. Yeah, it was unmuted there. Okay, now it. Sorry, it will. Okay, is that better?
It is.
Not really.
Give it a try again one more time.
It'll be better if you were just turned off there.
Yeah,
there.
perfect.
Just audio.
Yeah, I'm unmuted. I have unmuted myself.
We hear you now. Just try another time.
Yeah, can you hear me now?
Yes, better now.
Okay, so.
We do see what you wrote in the chat as well, because the sound is not coming through.
Okay. Since time flies and we will lose, so maybe we can switch to Nicholas and Noor that might have some questions. Just
there's 5 minutes
Dorothy,
left.
you can add to the chat if you need.
Just very quick. So my question is, why is there never a discussion about airborne PPE such as N95 and elastomeric respirators providing better droplet protection than surgical masks?
Does anybody want to answer that? You mean even, and I saw from your question, you mean even people that are advocating droplet precautions, why they're not advocating for better protection from droplets, which incidentally protects against, Does anybody?
I can just tell you that, in Alberta, amongst the PHAC group, and I don't know if it's the same in other provinces, there's honestly a feeling that there's no problem, that despite the 6,000 nurses and 200 doctors that have gotten COVID over the pandemic, according to PHAC, they all got it either from community spread or through PPE misuse, not inadequate PPE. So if you don't have a problem, you're not going to be looking for a solution. And so I blame it on that inability to recognize the problem.
Yeah, I think that's fair comment.
I'm going to add to that WHO researcher clinician from Canada. I think it's in Alberta.
Yes, we all know who he is.
Has published research, and even with Dr. Kimberly Prather and Dr. Fishman, who's a member of Masks for Canada, denies that aerosols and airborne transmission has really occurred.
Mm-hmm. Yep, we know that's what we face.
That's Alex Griffin here. I see Noor is on here from Australia.
Yep.
She might want to share some of her experience from Australia, if that's okay.
Yep, she's next in line. Are you? Hi, Noor. Can you hear?
Hi, can you hear me?
Yes.
Mm-hmm. Yep.
Wonderful. I didn't have a question. I just wanted to support the idea that we need masks when there's low prevalence, because all of our larger outbreaks, the second wave in the state of Victoria, were actually forensically and genomically traced back to a single source. So if you have a single case, and that was not Delta, that was not even Alpha, I don't think. I think that was just normal.
Wild, as they call it.
So if you can have large outbreaks from the chance that you're going to have a source that happens to be a high shedder, then you can't live in this world at this time without taking some basic precautions. That's what I feel.
And is that happening in Australia or only?
No. So what happens here is that we have no mask mandates until there is a breach of quarantine. The breach of quarantines have been occurring more and more often since Delta is becoming more and more prevalent worldwide. So initially we would have, months go by, many weeks at least, with no breach of the quarantine system. Now we've been having multiple breaches per month. Pretty much every week we're hearing something is happening. Now we're trying to fix the airborne issues in quarantine and the recommendations for the type of respirators to be used as opposed to surgical masks. However, the reality is that process is quite slow, and we will be having more issues in the near future, if not currently, because we're currently in an outbreak, and so it'd be a little bit difficult to tell what's new and what's old. But I think during the period where we could control it well at the border, not wearing masks in between was quite welcome and fairly reasonable. Now it's just not possible because the world is surging in cases. And I think that even in a fairly safe environment like Australia, you have to take into account the global situation and not just what's going on at home when you make policies and you continue to repatriate your citizens or allow essential travel.
Thanks. That's really helpful. Perfect. Yep. And I think it is 10:30.
Valerie, we still have one question from Carlos from Spain, and I think we might end up with this question if it's fine for everybody. It's already 10:30. You're right, but that might be the last question. And I thank you all for being patient
very
and
much
being there. So maybe Carlos, you can jump on.
Okay, thank you. Well, I'm from Chile, by the way.
Oh, sorry for that. Okay, just
close enough.
A mistake. But anyway, from Chile, thanks, and ask your question.
Well, here mask usage is a mandate. You have to use them outdoors and in the offices. But we're having issues because of how people are educated on how to use them. They just use them on scarves, earrings. They don't cover their nose. And that is something that's I've seen quite a lot. Like they just use them, but they're not actually wearing them correctly. Also, we've been testing masks, and even surgical masks it's just not enough coverage. 70% of filtration in surgical masks and we're expecting over 90%. So when this testing began 2 months ago, we started recommending all our medical staff to wear double masks, because we were afraid that the people that is working in healthcare were actually getting infected, even though they were wearing masks, just because of the low quality, the low filtration. So how's the education going on, well, wherever you are? How's people being educated on how to use a mask? And is the filtration quality being tested?
I don't know if any of the speakers would like to answer that. Education about fit as well as filtration, I think, is an important issue. Sure, Lisa, were you?
In the beginning of the pandemic, there was a lot of educational videos on how to wear a mask, put it on properly, not to contaminate. There was no education on filtration fit, largely because even surgical masks were in short supply and were kept for healthcare. And ever since then, even though there is no shortage, they haven't really ever encouraged only surgical or even less respirators. But it sort of became understood when they started to make people switch to the surgical masks if they want to go to the hospital or a clinic. They started to only surgical masks in a lot of classes in high school and elementary schools. Workplace also would have to be surgical, couldn't be cloth. So without saying it, people caught on that, not masks are created equal, and we don't see that many cloth masks anymore here. But they haven't really said not to use them into entire quality masks, and they definitely haven't spoken so much about fit.
Okay. Yeah.
Thank you.
Thanks. There is a video. Dorothy, can you put in the link to that video for workers that it's in Spanish and English that we were discussing today?
Oh, okay.
Thanks. I guess as long as we keep the chat open. I'm not sure if you can save the chat in this program.
We'll learn. I don't know, but we'll see. But anyway, for those who would stay a bit more and would like to get the link, Dorothy, you can definitely put that there. I think we're at the end.
Yes.
Anyway, so those who would like to stay a bit and chat, there is no problem. I think there is nothing in this room for the next half hour for sure. But there are other meetings from some groups right now. Thank you very much. So we are pleased you've been at the Canada session. We hope you enjoyed it, and great questions were asked. Really pleased by the panelists' comments and insights. Thank you very much. So don't hesitate to protect yourself and others, get vaccinated, help spread good information, so that's a key here, and put forward the precautionary principle. I think a science-based decisions and initiative to reduce the risk is what we all need right now. So thanks very much, and for your patience, to have supported my French-Canadian accent all that time. Thank you, Valerie, for helping me, making less mistakes. So that's, thank you all.
Yep. Thanks, everyone. We really appreciate it. And hopefully we'll see some of you in the meeting in the team rooms and the lounges over the course of the rest of the summit and in the future, sharing solutions. That's what we want, right?
Yeah.